Successfully getting your patients to return to work in optimal health and with minimal delay relies heavily on choosing the right care team partner to help facilitate healing and coordinating care. So where do you begin? There's so much at stake when a workplace injury threatens life and limb. Vital to the best clinical and return to work outcome is a comprehensive care partner to help maximize and coordinate all available resources, decrease morbidity rates, and ensure compliance to the overall treatment plan. At HyOx Medical Treatment Center, we come alongside you to assist in managing the continuity of care by providing regular assessments, photographs of healing progression, coordinating with multiple providers, and building patient trust with our healthcare team. Our standard of care helps you ensure quality and healing. HyOx's board-certified physicians and multidisciplinary clinical team are here to help. HyOx Medical Treatment Center is a nationally accredited hyperbaric medical facility. We specialize in healing the body naturally, simply by breathing. Did you know the air you're breathing right now is only about 21% oxygen? Well, at HyOx, our double board certified physicians prescribe 100% oxygen. By breathing in the oxygen in a pressurized, spacious room, your body's oxygen content increases by up to 1,500%. This unleashes a turbocharged wave of healing molecules throughout the body to supersaturate every cell. Hyperbaric medicine effectively reduces pain and swelling, prevents complications, and accelerates the healing process in patients with crush injuries, thermal burns, wounds, infections, and those experiencing complications from diabetes. When added to an injured worker's care plan, hyperbaric medicine expedites and boosts the healing effectiveness of traditional treatments, including antibiotics and surgical intervention. Our distinguished physicians, Dr. Richard King, board certified in physical medicine and rehabilitation, and Dr. Marianne Tarila, board certified in emergency medicine. Both physicians are double board certified in hyperbaric medicine and are both recognized as wound care specialists. In many workers' comp cases, hyperbaric medicine is considered an immediate, crucial intervention, only second behind an emergency room visit. Early intervention with hyperbaric medicine enhances the effectiveness of wound care, antibiotic efficiency, pain management, and any other needed treatments for the best possible recovery of an injured worker. HyOx helps unlock the body's natural power of pain relief. We prescribe oxygen as a drug. Hyperbaric medicine relieves pain. It enhances tissue repair, reduces swelling and inflammation, and increases the blood flow to impacted areas to promote cellular recovery. And most importantly, it helps prevent patients from the dangerous and costly epidemic of the opioid addiction. Hyperbaric medicine is an evidence-based and approved treatment for common workplace injuries. These include thermal burns, which occur from contact with fire, hot cooking oil, boiling liquids, steam, and various other heated objects, including machinery. Acute traumatic peripheral ischemia, or more commonly known as crush injuries, are life and limb threatening conditions that immediately compromise circulation, caused by heavy compression on the body, or when a body part is compressed or crushed between two objects. These injuries deprive tissues, muscles, and nerves of oxygen from the sudden loss of blood supply. Please keep in mind, a referral for hyperbaric medicine would benefit a patient as soon as they are discharged from the emergency room or an urgent care center. Hyperbaric medicine restores blood flow and reduces inflammation to help recover limb function, and in many cases will prevent amputation. Compartment syndrome commonly occurs in tandem with crush injuries from the increased pressure within a confined space or compartment in the body, typically due to swelling or bleeding. This increased pressure can impede blood flow to the tissues, leading to tissue damage or potentially critical complications. After a severe workplace injury, a potential surgical complication may occur if a skin graft or flap becomes compromised due to swelling or poor blood flow post-surgery. Hyperbaric medicine creates new pathways of blood vessels. This healing benefit, called angiogenesis, allows blood and oxygen to access the injured area faster to decrease swelling and prevent infection. Hyperbaric medicine is an effective and necessary treatment to avoid further surgeries and additional amputations. The word necrotizing signifies the death of most or all of the cells in an organ or soft tissue. This could be due to disease, injury, or lack of blood supply caused by bacteria. Hyperbaric medicine treats necrotizing soft tissue infections such as necrotizing fasciitis, gas gangrene, osteomyelitis, and diabetic foot wounds. In addition to its many other healing benefits, hyperbaric medicine helps enhance the transport of antibiotics across cell walls to help keep the infection from spreading. In such progressive and aggressive infections, resolving the infection and salvaging the affected area or limb are the superpowers of hyperbaric medicine. Chronic, non-healing wounds from bacterial infection, burns, or complications from diabetes can destroy skin, tissue, and bone, and should be immediately considered for hyperbaric medicine. At HyOx, our certified wound specialists excel in treating a variety of complex wounds stemming from infection, trauma, and chronic disease. For many workers' comp patients, addressing wounds secondary to initial diagnoses, like crush injuries and third-degree burns, is paramount. Our integrated approach combines wound care with hyperbaric medicine to create an unmatched, comprehensive healing treatment plan. Some workplace injuries happen in the water or at high altitude. Hyperbaric medicine is the gold standard of treatment for injuries caused by a rapid decrease in the pressure that surrounds you, either in the air or water. A recent emergency case HyOx treated was a commercial diver working underwater on a dam who experienced decompression illness while ascending too fast. He got a toxic level of nitrogen bubbles in his bloodstream and spinal cord. Hyperbaric medicine helped reduce the toxic amount and size of the nitrogen bubbles in his bloodstream and saved him from losing his ability to walk. Chronic regional pain syndrome is a condition characterized by severe and prolonged pain, typically affecting an extremity after an injury or trauma. The pain is often disproportionate to the initial injury and may be accompanied by changes in skin color, temperature, and swelling in the affected area. Medical professionals agree early treatment is vital to treating CRPS. Keep in mind, treating workers' comp patients with hyperbaric medicine immediately following the initial injury may prevent CRPS from ever happening. It's one of the many costly complications that hyperbaric medicine may prevent. Carbon monoxide poisoning is an emergent condition for hyperbaric medicine. After being stabilized by emergency personnel, a referral to hyperbaric medicine flushes the toxin out of the body to prevent long-term neurological side effects. Sudden sensorineural hearing loss, or sudden deafness, happens to one ear from damage in the inner ear or in the nerve pathways between the ear and the brain. This emergent condition requires hyperbaric medicine and steroid treatment within 48 hours of hearing loss for the best outcome. HyOx is proud to have contributed to many professional and collegiate athletes' faster return to the field. Sports-related injuries to the bones, muscles, and ligaments benefit from hyperbaric medicine's ability to increase tensile and bone strength by boosting tissue oxygen content by up to 1,500%. Hyperbaric medicine heals and helps prevent future complications and injury. Please reach out to us for more information about treating workers' comp injuries. And for a deeper dive into what we do and what we treat, including case studies with before and after pictures showing the healing progression, please visit HyOx.com. Thank you for making us a trusted part of your healthcare team.